In the beginning, I was diagnosed with hemophilia at the age of 2 in the 1980s in the United States while teething. Then I was re-diagnosed with von Willebrand deficiency in England while doing my appendicitis surgery. I was to be treated with cryoprecipitate in the beginning. Then we used to be treated with concentrated factor VIII. Then with the delivery of my first child in 2003, I started using Bilfactan that used to be imported from France and was very expensive. It was safe, it was efficient, but too expensive, and we had difficulty importing it from France. By the delivery of my third child in 2012, we heard about the SD cryo that was manufactured here in Egypt, how safe it was and how efficient it was. So I decided to start using the SD cryo. It was more efficient, available, and still safe to be used.
Blood transfusion industry or blood transfusion service started late 19th and early 20th century. And with the development of the plastic bags, there was a significant improvement in collection and preservation of the blood, and also the ability to separate the blood into components. Cones could develop a method to collect this plasma, pull it, and fractionate it into medicinal products, namely the coagulation factors like factor VIII and IX, the immunoglobulins, and the albumin. There was the development of what was called the cleaning methods of the blood or the virus inactivation of the plasma. Consequently, this led to a much safer product. The patients now were convinced that these products are very safe. To use it regularly to convert these people into normal people. We can expect that these products are very expensive, and that the classical fractionation industry at the end was not affordable to more than 70% of the patients across the globe. From this, we had the idea that we need to think out of the box. If we could miniature this large fractionation industry into something like the smartphones, we can deliver this technology to developing countries. With this, we developed several devices. These devices to enable production of virally inactivated coagulation factors, what we call solvent detergent cryoprecipitate, and virally inactivated immunoglobulins, what we call mini-pool intravenous immunoglobulins. So the solvent detergent virus inactivation of many pools of cryoprecipitate comes in the form of a sterile medical device, which is formed of interconnected bag system, and which includes a filtration system. To this system, as we can see, we can pool up to 35 units of low plasma volume cryoprecipitate. The pooling happens one after the other, following the instructions for use of the kit. Then we pool the solvent and detergent, which is TNBP and Triton, together, and mix them, as we can see, to inject the solvent and the detergent mixture into the pool of the cryoprecipitate in the sterile bag using an injection pump, which injects the product at a specific rate. The injection is happening while it is incubated at an incubator at 31 degrees, and this is a shaker incubator, and we shake the pool at 150 RPM. At the end of the incubation, we remove the solvent and detergent syringe, and we inject the soybean oil, which helps to remove more than 80% of the solvent and detergent. When adding the oil, we mix by hand for 1 minute the oil with the solvent detergent cryopool mixture, and then we place into the shaker incubator at the same temperature and speed for around 15 minutes for thorough mixing of the oil with the solvent detergent cryopool mixture. And then we hang vertically this pool in order to have a phase separation, and this is followed by a filtration process to remove any residual TMBP and tritone, and it also purifies the final product. Then we do the quality control for the product in order to be able to label the individual units with its content of factor 8, von Willebrand factor, factor 13, and fibrinogen. The product is regularly used in our center by 20 patients since more than 10 years for prophylaxis from bleeding in patients with severe hemophilia A, and some of them use it as a home use, and the results are almost equivalent to the industrial product or the pharmaceutical product.
من أصعب التعب بيشوفه بالذات لما يكون نازف في مفصل أو حاجة، أو أحيانا كتير يعني ما بينامش، مفيش نوم، تعب رهيب، ما بيعيط على طول، مفيش راحة خالص. فبنيجي نديله حقنة هنا، ياخد الحقنة نركب له الفاكتور أو اس دي كرايو، ومجرد ما ياخد الحقنة طبعا هو بتوقف النزيف. توفر الحقنة لمرضى الهيموفيليا عامة هو ده العلاج بتاعهم. باخد 4 اس دي كرايو، في واحدة بياخدها هنا وباخد 3 معاه البيت، كل أسبوع بياخد واحدة.
العلاج بياخده وقائي علشان بيحميه من الخبطات او النزيف في الركبه او في المفاصل بمعنى صح. لو هو مخبوط بيبقى فيه ورم في الركبه، بيجي ياخد العلاج، بيفضل جرعه او جرعتين والالم ده بيروح والورم ده الحمد لله بيروح.
انا اسمي يزيد محمد يوسف، سنة 13 سنة، وعندي مرض اسمه الهيموفيليا. باخد علاج في المركز يوم، وباخد الكيسين تانيين في البيت.
We started using the SD cryo in several surgeries later. My father used it for 2 cardiac cases. Their name in Arabic is Astara. He did that twice. Then he broke a bone or something in his leg, and we used the same SD cryo for the surgery itself, and it proved to be extremely efficient.
The second device that we developed is intended to purify plasma immunoglobulins and virally inactivate the immunoglobulins, and also to concentrate these virally inactivated plasma immunoglobulins into a concentration of about 5%. The technology depends on pulling about 20 units of plasma in 10 transfer bags provided in the medical device, and inject the caprylic acid to each of these bags, incubate them at 31 degrees and a speed of 150 RPM for about 1 hour. And this enables the precipitation of the immunoglobulins, all the proteins except the immunoglobulins, and in the meantime it is a viral inactivating step. Thereafter, we centrifuge these bags to express the supernatant immunoglobulin solution, pull it into 3.5 liter pulling bag cascade, which can be connected to ultra filtration filter to concentrate this pool into 5% concentration of the immunoglobulins. Then subjected to a purification and filtration process, which purifies the immunoglobulin solution. And then we subject it to quality control to obtain the concentration of the immunoglobulins, and based on this, we distribute the doses of the immunoglobulins into the inline satellite small bags, and with this we have a virally inactivated plasma-rich immunoglobulin solution, which can be used for different indications for the use of the immunoglobulins, and we have so far validated its use in the treatment of pediatric population with acute ITP, as well as testing its efficiency and safety in treating patients with primary immunodeficiency.
The concept of being available all the time for any emergency to happen or for anything that would occur suddenly is the safest option for us to use, especially that it is also clean. We trust the checkpoints that it goes through before being delivered to the patient.
And with this, they have an alternative to the plasma-derived medicinal products. They have the same safety and efficacy of the medicinal plasma products, but in a condition or in a miniature of the large industry that can be afforded by the developing countries.